Good morning, everybody, and welcome. Thank you for joining us this morning. My name is Jennifer Ahern. I'm the Chief Officer and Permanent Secretary in the Ministry of Health, Sports, Youth and Culture. I'm joined this morning by the Honourable Osborne Bodden, who is the Minister for Health, Sports, Youth and Culture, and Ms. Lizette Yearwood, who is the CEO of the Health Services Authority, but is here this morning as the Chair of the Planning Committee for this year's National Healthcare Conference. I want to thank you all for coming, but I want to give a special thank you to Tenet Healthcare, who are our Premium Plus sponsors for the conference. They've been on board with us for a number of years now, and we're very grateful for their support. And we have some representatives from Tenet with us today, so welcome, gentlemen, and thank you for joining us. We also have one of our other sponsors represented this morning. Welcome to Kathy from DART. Thank you for coming out. So the reason that we're here this morning, we're very excited because it's to announce the dates and the theme for this year's Cayman Islands Healthcare Conference. As many of you will be aware, we've had this conference annually since 2010, and we're excited now that we're in our 5th year. Before I hand it over to Minister Bodden, who's going to announce the theme, I'm going to ask Ms. Lizette Yearwood, who, as I mentioned, is the Chair of the Planning Committee, to give you some more information about the conference. Thanks, Ms. Lizette.
Good morning, everyone. Thank you, Jennifer. I'd like to join our Chief Officer by thanking you all for being here today. I'd like to also recognize representatives from Tenet Healthcare, our Premium Plus sponsor this year, as well as Kathy from DART. It is as a result of sponsors such as you are that we're able to offer this conference free of charge to our delegates for the 5th year. And our delegates, I'm very happy to say, is not just members of the healthcare community, but these are individuals who are from insurance companies, the business community, educators, and the individual member of the community who wants to be healthier and adopt a healthier lifestyle. So we wanted to make sure that this is a national conference that is organized by the Ministry of Health, and we want to make sure that we have input from our planning from stakeholders across the Cayman Islands. So we start off early, our planning. We have a planning charrette, and at that planning charrette we invite in representatives from these stakeholders. We have doctors, nurses. We also invite in members of the insurance companies, the health and wellness professionals. We come together and we really examine what is going on with health in the Cayman Islands at that time. And from those discussions, we actually come up with our theme for the year. And it is from that collective, collaborative planning that we believe that this conference has been a tremendous success over the years. So the Minister, Honourable Osborne Bodden, is going to tell you what our theme is this year and a little bit more about what to expect. Minister Bodden.
Okay, good morning and welcome to everyone. Special welcome to the sponsors, the major sponsors here today, DART and Tenet, of course, our Premium Plus, and to the media. Thanks for having us this morning. I'd like to recognize, of course, on the panel here with me, my Chief Executive Officer of the HSA, Ms. Yearwood, the chairperson, and of course my right hand, my CEO, Ms. Ahern, who spearheads this conference from the ministry side every year. I would like to say that Tenet has been sponsoring now the conference for, I think it's the 3rd year in a row, or is it the 5th? 5th year in a row. And you will be sponsoring also a lunch for the delegates, and we are honored to have some of the representatives in the room with us this morning. In addition to Tenet, the other confirmed supporters of the event include DART, Tower, the Cayman Islands Health Services Authority, of course, United Healthcare International, Cleveland Clinic, Cerna, the Heart Health Center, St. Luke's Mid-America Heart Institute, Broward Health, Generali Worldwide, and Pinnacle Media. Additional exhibitors include 21st Century Oncology, Fundación Cardiovascular de Colombia, and Cayman Hospice Care. I thank all of the organizations that have given your funding and support for this annual healthcare conference. Your willingness to be part of this vital event means that we can produce a truly first-class conference. year after year at no cost to attendees and no cost to the Cayman Islands government, and for that we are extremely grateful. I would also like to take the time to mention that there is still plenty of opportunity for sponsorship. So if you are not already on board, please feel free to become a part of the very important conference. We are now on our 5th year holding the Cayman Islands Healthcare Conference, which will again be held at the Ritz-Carlton from Thursday 20th of November to Saturday the 22nd of November. The 3-day event will feature an impressive lineup of highly experienced professionals from overseas as well as locally who will be imparting their knowledge for us all to benefit. This year's theme is Winning the War Against Chronic Non-Communicable Diseases. This theme is a very important one and is likely to affect you personally or a friend or a family member. Chronic non-communicable diseases are often referred to as CNCDs. These are diseases that cannot be transferred from person to person. Some of the CNCDs that we will be focusing on this year are cardiovascular disease, diabetes, cancer, mental health, respiratory disease, and obesity. We aim to have this conference be informative and educational, not only for the medical community, but for the general public as well. CNCDs are diseases that are often preventable, and we are encouraging people to take charge of their lives and live a healthy lifestyle. As most of you know, last year's conference was focused on workplace wellness and made an impact on many. Over the past couple conferences, we have held breakout sessions that are interactive with all of the delegates and produce actual outputs to be brought back not only to the ministry, but things that can be implemented in the workplace and in your day-to-day lives. One of the most recent events that government has done to get fit is Deputy Governor Franz Madison's first Deputy Governor 5K run. Mr. Hearn here was a huge player in this event and joined with 3 other civil servants, Tony Watts, Charles Gilman, and Tara Bush, to start a walk-run club within the civil service. The 5K took place 2 weekends ago and had over 600 participants, many of them being civil servants. The HSA and Public Health also launched just yesterday their smoking cessation program called I Can Quit. It is important to me as minister that our conference serves a purpose, and each year we strive to produce ideas and actionable items that delegates can take away from them and apply to their own health and well-being. We had over 600 delegates last year, and we recently reached out to them to get feedback as to what they have done at work, at home, and at play to help better themselves as they work in their workplace environment. At this year's conference, I will be sharing some examples of the positive outcomes from last year's event. Of course, this year we are planning on having the same purpose, for each and every delegate to learn something new, something that might ultimately save their life, and make a life change with this new knowledge. As in previous years, this conference is not only for the medical community, but also for employers, educators, insurance providers, parents, and anyone interested in learning more about improving your health. This year, we'll be having more workshop sessions, which will allow for smaller, more interactive groups. I believe it is important that delegates don't just sit and listen to a speaker, but actively ask questions, interact with each other, and gain knowledge that will help improve their health, and these workshop sessions help to facilitate that happening. There will be 4 workshop sessions on Friday, 2 focusing on CNCDs in adults, and the other 2 groups focusing on children. As a small community, it is important that we get together and communicate with one another as to what programs are in place, where there are opportunities or gaps, or whether the community is aware of the support that is available. These are just a few items that will be discussed in these groups. As many of you will recall from our 2012 Health in Nation survey, it was clear in the findings that many Caymanians are leading unhealthy lifestyles. We smoke, we are overweight, and sometimes even obese, and we are not getting our 5-a-day recommended amount of fruits and veg. Perhaps even more of a cause for concern, far too many of our children are overweight or obese. Based on annual health screenings on children in transition from lower to middle school, a survey found that 22% of our school children are overweight, and an additional 15% were deemed at risk of becoming overweight. Staggering statistics. In addition, among school children, there are indicators of high levels of obesity. Such risk factors within the school population are a predictor for the future development of chronic NCDs in the Cayman Islands. We know from medical research that many of the diseases such as diabetes, hypertension, cancer, and heart disease can largely be prevented if we follow basic health and lifestyle guidelines, and yet we still choose to ignore them at a greater cost to our and our children's health. Conferences such as this year's National Healthcare Conference can go a long way in better educating us all on the consequences of not following a healthy lifestyle, and reinforcing in our minds the need for change, and perhaps more importantly, how to go about making that change. A new element to this year's conference is the not-for-profit showcase area, which will be called the CNCD Room. This room will showcase a range of not-for-profits and the services and programs they provide for our community. These organizations are pivotal to our community, so we are looking forward to have a space where they can be highlighted. We are excited to have Cayman Hospice Care on board and look forward to many others' participation. I would also like to announce that Dr. James Hospitalis, Executive Director of CARFA, the Caribbean Public Health Agency, will be opening the conference on Thursday evening. He's going to be speaking on the global and Caribbean situational analysis of CNCDs and associated risk factors, some of the global and Caribbean strategies, goals, and objectives, and how CNCDs contribute to sustainable development. We will be confirming the rest of the speaker lineup over the coming months, and I'm confident that all our delegates at this year's conference will find the same outstanding level of speakers at this year's conference as we had at last year's conference. As mentioned earlier, we had over 600 delegates in attendance last year over the 3 days and over 40 sponsors. Every year, this event gets bigger and better, and I'm looking forward to another successful year. But in order to offer this conference free to delegates, we rely on sponsorship, so please sign up now. So this year, more than ever, we have again tried to make the conference as inclusive as possible and to get as many residents as we can to come and take part in this vital event, to give everyone the opportunity to come and learn more about how to look after their health as well as friends and family. Thank you to the local media, sponsors, and planning team that are here today. The Minister of Health is looking forward to this event. For sponsorship information or updates on agenda and speakers, you can visit the conference website at www.healthcareconference.ky. So that's www.healthcareconference.ky. I encourage everyone to mark their calendars for November 20th to the 22nd, and I will look forward to seeing you all at this year's conference as we work together on winning the war against chronic non-communicable diseases. Thank you all again, and have a great day.
Thank you very much, Minister. We'll now open the floor up if there were any questions. And we do have a microphone, so you need to wait for that.
Just double checking, what's the one thing you'd like the participants or the people that attend to walk away from this particular conference?
Do you want to answer that?
Well, the one thing I'd like is to understand the importance of personal responsibility, to understand that your health is really in your hands when it comes to non-communicable diseases. Basically, it's all sort of piggybacks on last year's conference, which was wellness in the workplace. But this is just targeting those diseases and ensuring that you can really try and avoid contracting any of them.
I see mental health is on there. It's a controversial topic. Can you give me a little outline of what you guys are going to be covering in terms of mental health at the conference? Are you going to be doing lectures? What's going to be happening in that area?
Yeah, we're still in the process of organizing our speakers. We will have more information once we actually confirm the lineup of speakers. But certainly mental health will be part of the breakout sessions. That has been a very, very successful component of the conference, and that involves participation of all the individual delegates at the conference itself. So we are looking forward to having representatives from the mental health community at those breakout sessions.
Just to add to that, as you know, mental health is very topical at the moment. It's very important issue for us at the ministry and at HSA, and I think it's a national issue, and we've made no secret that we're going to be tackling finally trying to find a long-term solution, not just a temporary situation that we have at HSA, but we certainly need to work towards a long-term facility. The Mental Health Commission, which came through the revision of the mental health law, is very active. Dr. Lockhart is chairing that committee, and they're busy working and coming up with strategies to move forward. Naturally, any building will take time to get, but we're looking in the meantime at a shortcut to that in utilizing any existing buildings that government may have that we could look at housing for young people as well as for adults. So it's very topical, and I think I'm very happy to see it on the conference, because certainly we're going to keep it in the spotlight.
Any other questions?
Yes, of importance always in terms of health is knowing your numbers and where the leadership is. We know where the former governor was in terms of this. We know where the current premier is in terms of this. My question is now to the panelists. How frequently do you take your numbers, and do you know your numbers? And maybe could you give us examples of what are your last numbers taken? Yes, I'm referring to BMI, your systole, and your diastole.
Right. Yeah. Yeah. I mean, I do know my numbers. I don't really want to share them with you, but I do.
Numbers are illegal.
Certainly, the message from the ministry has been the importance of prevention, and the importance of things like knowing your numbers, and as Minister mentioned, personal responsibility for individuals in their own health and in their family's health. So the message that we have been trying to get out consistently is know your numbers. When we did the Healthy Nation survey, it was about getting people to be more aware and to know their numbers. So I can say that I do know my numbers, and I think they're okay. But I certainly have, I think, Minister mentioned in his remarks that the civil service from last year's conference, there's been some things that the civil service has done. The Deputy Governor, when you talk about leading from the front, he initiated his first ever 5K challenge to the civil service, also to the private sector as well. But we had a tremendous response from within the civil service. There were people who came out 2 weeks ago on a Sunday morning and walked 5K that never ever would have even thought about doing it before. And so, the Deputy Governor certainly has set that tone within government in the civil service. I know the Minister, you can speak to it, sir, but he's embarked on his own wellness initiative since becoming the Minister of Health as well, and he's taken some very positive steps. And I'm sure that he's seeing his numbers improving too. So, and Miss Yearwood, she's always got awesome numbers. So.
Actually, I'd like to add to that. I firmly believe that it is important to lead by example. And we at the Health Service Authority just launched our Take the Challenge at BFIT program. So our staff are engaged in that program, and we believe that if we're going to go out and speak to other corporate communities about taking charge and being accountable for their wellness, we also need to lead by example. So not just myself, but other members of our team at the Health Service Authority are also leading by example. So absolutely, we totally agree.
We certainly are, and one of the things I said at the last conference was that we're going to have a gym in this building one day, and we don't have it yet, but we're going in the right direction, and I'm positive, if not by this conference, certainly by the next one, there will be a gym in this building. People are certainly taking more personal responsibility. It's quite obvious, and I think the recent events have really led to a renewed interest in becoming fit, and it's contagious. I mean, I walk around and people go, "Oh, you've lost weight," and I found 10 pounds since Easter, but I did lose 25. But it's good, and you have to take care of yourself, and at the end of the day, we can all do it.
And Cineco, and you may have heard in the media, Cineco is celebrating their 10th anniversary this month. And they're also launching a new website that has a wellness portal that encourages and rewards people for going online, putting in their numbers, improving their numbers, buying healthy foods, taking active living steps and things like that. So there really is a push on to sort of increase the message and to facilitate people being able to take preventative steps and to embrace wellness and healthy living. I'm assuming that you know your numbers and
maybe coach would have said that you're exempt that question, having been my coach in other.
okay. I think I saw you on your bike this morning, so thanks. Are there any other questions?
Yeah, I'm actually kind of happy you brought up that cynical point. I was there, not at the 5K run, not running, helping to direct traffic, and it was said that Cynical was rolling out a new rewards program where you would get deductibles or something of the sort. I actually just wanted to clarify that a bit more. What exactly is the scheme, and what are some of the rewards that people will get? Are we looking at lower health premiums, or what's the overall goal of the scheme itself?
I don't want to steal too much of Cineco's thunder, actually, on that. But it is the program is about incentivizing their clients to embrace wellness and active living and healthy lifestyle, and they'll be able to go on and accumulate points towards different rewards, various different rewards. And they've partnered with a website from Canada that is well established and has been tracking metrics and seen some fantastic success with members who have used it. So, but I don't want to say too much because it's Cineco's story to tell, really. So.
Oh, they were?
Yeah,
Oh,
yeah.
okay.
I know they've been out talking
Their
about it.
anniversary's
But,
coming
yeah.
Big launch.
Okay.
And just another question. Right here, you were saying that from the 2012 Healthy Nation survey, 22% of children were found to be overweight, and 15% were found to be at risk of becoming overweight. Now, since then, have we seen any decrease in the number of children? And what programs has the government brought forward, if not this administration, well, the one before? Has there been anything to help curb it, and was that a success? Is there any way for us to judge, or did we see a decrease in the numbers?
I'll let Lizette answer, but I just want to clarify that the data for the children isn't from the Healthy Nation survey. The Healthy Nation survey was only on adults, and the data for children is from the school entry surveys and that. So, but Lizette, I don't know if you want to speak to.
Yeah, I mean, just briefly, we work closely with the schools. We have nurses in the schools, so we have a school health program, so we work along with the children. And also, we work with NGOs to provide programs for the school, for the students after school. We have the Cayman Active Group, and they're working on the program. We don't have up-to-date numbers as to the results of that as yet, but we are very, very keen on making sure that we have a significant impact in reducing those.
Yeah, my final question would
But
be...
just before you go off, Andrea, just from the ministry perspective, it's very important that we recognize we have these issues and we deal with them. And as Minister of Sport as well, our focus is heavily in the schools with interscholastic sports, something that it sort of fell off. We're bringing that back. The Minister of Education is also driving home the fact that it's important, for the kids to be healthy in school, to learn better. All of the increase in sports programs, I think it's we don't know, as we say, the direct results since 2012, but I would venture to say that we'll see some decrease, because right now I think we're having a much more active population.
Okay. And my final question is, do you know any numbers going into this conference? Are there any current statistics based on the issues that you're trying to target? So for mental illness, do we know what percentage of the population is suffering? Or for any of these other non-communicable diseases, are there any figures right now that we could use as a benchmark for next year to say that we've seen a decrease or rather an increase? Thank you.
The 2012 report.
Yeah,
Sorry, did you want to answer that?
Yeah, the 2012 report that Minister mentioned in his remarks, that gives us the basis of what the status is currently, and then we will be able to measure that in future years.
And other tools. For example, we have the cancer registry that Minister mentioned in his contribution to the debate this week. We're working on legislation to make a mandatory reporting requirement for that. But the registry exists currently, and so we're trying to get some data from that in terms of the incidence of cancer and the prevalence of the different types of cancer. So that's one of the things we're looking at. And the Mental Health Commission as well, in their work, are looking at how to better gather and compile statistics on mental health issues.
I guess those questions, if I can just follow up on that, I guess the question would be, when is the next healthy living or healthy lifestyle survey that the government's going to produce or conduct?
The survey was in 2012, and I think ideally we would want to repeat that in the next 2 years or so.
Yeah.
We don't have plans to do it in the upcoming budget, which is 14-15.
I think every 3 years would be reasonable.
So, yeah. Okay. Are there any other questions? Just wait for the microphone.
Okay, my question there are two questions, especially with concerns to the cancer registry, but also with diet and the whole aspect of childhood obesity. We know very well that we have fast food establishments in the location of where we have our school district. I remember that 2 years or 3 years ago, the medical director of health was protesting and saying that those should not have been, although they were saying it in closed doors, that should not have been the case. I don't know what you have to say about the issue of having fast food establishments in the neighborhood of the schools in terms of diet, because with good, if you are to prevent obesity, then we always have to think about dieting and good food being available to our kids. Then the issue of the cancer registry. I was wondering how that can be enforced, because we are a transient population whereby people come and go, and it's so hard for us to be able to keep that data when we say that it is going to be compulsory. And how will these trends be measured of an expert who stayed here for 2 years and went back to East Africa?
For the cancer?
Yes, the cancer registry. What value will be of such data?
I guess in reverse order. In terms of the legislation for the mandatory reporting of the cancer registry, in the legislation, we'll be defining who we capture for the mandatory reporting by defining the tenure of somebody that would trigger them being someone that you would have to report. So we wouldn't be capturing someone who is here on a 3-month temporary work permit. That wouldn't be someone that you would be required to report. The idea is that we want to try and capture the information for people where there might be some sort of an environmental impact, that they've been here a sufficient amount of time that they might have developed the cancer while they were here, as opposed to arriving on island with it already being developed, or from environmental factors outside of our environment. So that will be addressed in the legislation. That will be defined in the legislation. In terms of the fast food by the schools, I don't know if Minister wants to speak to that, but...
That's a good question, and it's not an easy answer, because we can't just say shut your business down. But it is not ideal, that's for sure. It would have been much better if we had a bunch of salad shops around the school and veg, but it's what it is. I think it's, at the end of the day, it comes down to personal responsibility. The parents and the kids, have to take that decision, that choice. And if you don't buy the stuff, maybe the business will shut down and move away. But it's really, at this point, for instance, Burger King, we know that's close by. In fairness to the fast food establishments, a lot of them have gone a little healthier, and they're moving in that direction. Worldwide pressures on them. So, as I said, it's not an ideal situation, but it's not something that I can just wake up tomorrow morning and say, move your business away from the school. It comes down to personal responsibility.
Yeah, certainly. If we can educate people and educate the children about the importance of eating healthy foods, then they'll make those choices when they go to these establishments. And as Minister said, the establishments will respond. I mean, certainly when I was a child, I don't think we ever would have imagined that McDonald's would ever sell a salad. It was always Quarter Pounders, Big Macs, and fries. And, you know, because of the changes that we have seen and because of consumers' heightened awareness of the importance of eating healthy, you're seeing that McDonald's now has healthy options on their menu. So I think if we are able to continue to get that message out and to get people to take, as Minister said, the personal responsibility for making the right choices, we should probably see those establishments continue to respond.
Absolutely. And just to add to that, our public health team works very closely with the PTAs at the schools to be able to plan their lunch menus and also to do educational sessions at the schools so that the students understand the importance of healthy eating. And it's amazing the stories that come out from that, because the students then go home and put pressure on their parents. And, you know, from that, we are definitely seeing changes in the household because we're offering that education at the school level, so that the students are actually being responsible and making that positive impact on the family. And I'd like to also add to the information about the Cancer Registry. We will be, in addition to defining the individual who reports to the Cancer Registry, we're also going to be collecting the length of time that individual has been on the island, the location in which they're living, so that we can actually do this analysis. We can slice and dice that data to be able to have meaningful information that we can share with the people.
The conference workshops that Lizette mentioned in her remarks will be a fantastic opportunity for people like yourself who have these sorts of concerns to get together and have a discussion about what sort of steps we might want to see the different stakeholders take to help us win the war against chronic non-communicable diseases. So things like looking at the planning legislation to say maybe we need to put a no fast food or no restaurant zone within a 500-foot buffer of a primary school site. Those sorts of things would be the types of discussions that we would anticipate at these workshops. So, yeah. Were there any other questions? No. Minister, did you have any final remarks?
No, I just want to thank everyone again, and stay tuned. We'll be hearing a lot more about the conference, and we look forward to a very exciting conference. Thank you all very, very much.
Thanks again to our Premium Plus sponsors, Tenant, to Tower and DART, who are with us here today, and to all our other sponsors. As Minister mentioned, we still have sponsorship opportunities for anybody who would like to come on board. And if everybody could just mark your calendars, November 20th to 22nd at the Ritz-Carlton. And we will see you there as we join together and work on winning the war against chronic non-communicable diseases. Thanks very much for coming. Have a wonderful day.